Hello friends, I am Dr. Shailaja Sabnis, a consultant rheumatologist. What we saw in the last 2 decades, the changing trends of osteoarthritis in females. Earlier, we used to see more of degenerative or osteoarthritis more common in the 5th decade or the 6th decade. But recently, we are seeing young women coming between the age of 30 and 40 with severe osteoarthritis or degenerative changes. It comes to our mind naturally, why are we seeing degenerative arthritis in young women? Now there are various causes to it, but before that we'll tell you what is osteoarthritis or degenerative arthritis. Now when you see a joint, you have a cushioning cartilage which is at the end of the bones. When the cartilage starts decreasing or it has some deformities, it can cause degenerative arthritis. So what are the causes and why are we seeing it in young women? The most important cause is obesity or weight gain. We are seeing more and more women with high BMI, that is more weight gain. Most of them are working now. So they have a sedentary working lifestyle, sitting on the computers or sitting on their tables for more than 6 hours. Many of them are going in for junk food or a lot of fatty food, cold drinks, or mayonnaise or pizzas or burgers is the need for most women, and that is causing their increased weight. How many of them really exercise is the next question. So when you don't exercise, your bones and muscles get weak, which is the next important cause for osteoarthritis. Many of them females have already a past history of genetics, that is their parents have osteoarthritis, so they will have osteoarthritis much at a younger age. Next thing is many of them are sportswomen. They ignore their injuries or falls and then they don't take care of it or don't follow up with good physiotherapy. So these are the major causes, though there may be other causes like hip dysplasias, or they could have avascular necrosis post-COVID, or they could even have arthritis like inflammatory arthritis like juvenile idiopathic arthritis or psoriatic arthritis or rheumatoid arthritis which has not been treated, which leads to secondary osteoarthritis. Many patients unknowingly are not taking adequate calcium. Vitamin D levels are always low in most of the women. So what are the signs and symptoms when you are talking about osteoarthritis? Many of these women come with pain, continuous nagging pain, early morning stiffness. They have joint instability. They tell us that we keep on falling with minimal change in the level of the tiles. They have early morning stiffness, which means when they get up in the morning, they cannot do their work properly. They cannot stand up properly. They always have mild redness or pain continuously. They keep on taking painkillers. But how many of them really go to an ortho or a rheumatologist for early diagnosis and treatment, which is the most important thing? How do you diagnose osteoarthritis? Is by a simple history, clinical examination by the doctor, X-rays, SOS and MRI. So this is very important. Can you prevent the osteoarthritis? Yes, of course you can prevent osteoarthritis. So maintain your vitamin D levels, have good exercise. It is important to do at least a 45 to 1 hour exercise daily. Improve your muscle strengthening. So it is important to do weight bearing exercises as well, not just simple walking. Prevent any sports injuries, or if you do develop one, please get treated adequately. See to it that you take your vitamin D and calcium regularly. If you are very obese, it is important to reduce your weight drastically and have a healthy diet. Eat lot of spinach, high proteins, tofu, paneer instead of eating butter and cheese. So what you can do is stop your cold drinks, keep them off your table, keep the butters, biscuits, maida off your table, have a good millet increased diet, have lot of milk, you can have paneer, lot of vegetable, fresh fruits, and you could go in for a healthy lifestyle to prevent degenerative arthritis.